Are you sure that what you do in private is actually helping your health, or could it be silently draining your energy day by day? A 72-year-old patient once asked me something that truly made me pause. "Doctor, I've done it the same way for 50 years, but lately something feels off." He wasn't ill, no new medications, and yet he was experiencing unusual heart fatigue, mild prostate discomfort, and a strange lack of sensation. That's when it hit me. After age 60, even familiar, seemingly harmless habits like masturbation can begin to work against your body if done incorrectly. I'm Dr. Raven Mehta, a urologist with over 60 years of experience helping men reclaim their strength, circulation, and confidence without shame, drugs, or guesswork. Here's the part most men never hear. Your body changes in profound ways after 60. Nerve sensitivity, hormone response, blood flow, everything reacts differently to what you used to do effortlessly. And if you're unaware of these shifts, you may be disrupting your heart's rhythm, straining your prostate, and slowly losing the emotional connection that fuels true vitality. In this video, I'll reveal 7 common mistakes older men make during masturbation and how simple adjustments can help restore your energy, performance, and long-term health. Mistake number 6, I promise you, is one nearly every man makes. Before we dive in, now's the perfect time to hit that subscribe button and turn on notifications so you don't miss future advice tailored to men over 60. And if any of this resonates with you, drop a 1 in the comments. If not, type 0. Your feedback helps me create better content for you. Mistake number 1, using pornography as the primary stimulus. Let me ask you something uncomfortable but necessary. When was the last time you felt true, natural arousal from touch, from presence, from intimacy without a screen involved? One of the most overlooked changes after age 60 isn't just physical, it's neurological. I've seen countless men in their late 60s or early 70s sit across from me, troubled but confused, saying things like, "Doctor, I just don't feel much anymore. It's like something inside me went numb." They're not ill, they're not on new medications, but they are, unknowingly, overstimulated. So I ask a gentle but direct question. Do you often rely on adult content for stimulation? And almost every time, the man drops his gaze not out of guilt, but out of realization. It's not that porn is inherently bad, but rather that the aging brain isn't designed to absorb its constant intensity. You see, after 60, the dopamine system, the one responsible for pleasure, motivation, and reward, begins to lose flexibility. Fast-paced, high-intensity sexual content floods the brain with levels of stimulation far beyond what real life offers. Over time, the brain starts adjusting, by numbing itself. That spark of natural desire begins to fade. Sensation dulls. Touch doesn't register the same way. And connection, deep, fulfilling connection, feels out of reach. What's worse is that most men blame themselves. They think it's just old age. But more often than not, it's not aging, it's overstimulation. The brain, like any system, can burn out. And unless you consciously reset your sensitivity, the numbness may persist for years, even decades. But here's the hope. You can rewire it. Start by stepping back. Take a 2 to 4 week break from all visual adult content. Reintroduce simple, non-sexual physical touch. Hug your partner. Feel your breath. Relearn intimacy without needing fireworks. Let your brain rediscover the quiet beauty of presence. This isn't about shame, it's about restoring sensitivity. Your body still remembers how to feel, but it needs space and stillness to find its way back. If you've noticed a dip in pleasure, in connection, or in satisfaction, don't ignore it. This first mistake may be the silent root behind them all, and in just a moment, we'll explore another hidden habit that could be compromising not only your performance, but your heart health as well. Mistake number 2. Masturbating while sitting on the toilet. Let me ask you this: what if the very place you feel most private is actually where long-term damage is quietly unfolding? Surprisingly, the second most common mistake I see isn't about what men watch, it's about where they do it. And for many older men, that place is the toilet. I know it sounds harmless, even convenient. I've spoken with many men in their late 60s and 70s who quietly admit that the bathroom has become their sanctuary. A locked door, a few minutes alone, no interruptions, no judgment. But what they rarely realize is that masturbating while seated on a toilet, especially in that compressed, forward-leaning posture, can silently sabotage pelvic health in ways they never expect. You see, after 60, blood flow becomes everything. Circulation fuels erectile strength, prostate vitality, and post-orgasm recovery. When that flow is restricted even slightly and repeatedly, can have ripple effects on sensation, performance, and urinary control. And sitting on the toilet for long periods, especially while bearing down or hunching forward, impairs circulation to the pelvic region. It compresses the prostate, tightens the pelvic floor muscles, and places subtle pressure on nerves that are already more fragile with age. In my years of clinical experience, I've seen patterns too consistent to ignore. Men in their 70s complaining of dribbling after urination, trouble fully emptying the bladder, dull aches around the groin. Symptoms they never connect to this one private habit. But I've reviewed their scans, listened to their stories, and seen the consequences unfold. And more often than not, this hidden behavior is part of the equation. The truth is, your body wasn't designed for extended, intimate stimulation in a seated, restricted posture. That position tightens everything you're trying to open. Worse, the mental association between stimulation and bathroom isolation can reinforce stress-based habits that disconnect you from real intimacy. But here's the empowering part. Awareness is the first step toward change. If this resonates with you, it's time to reimagine your environment. Stand up, recline slightly. Give your pelvic region space to breathe, to circulate, to feel. Bring consciousness back into the act. Create comfort, not compression. Remember, this isn't about shame. It's about recognizing that the older body has new needs. Your prostate, your nerves, your blood vessels, they're asking for relief, not more pressure. If pleasure has felt dulled, or if recovery takes longer than it used to, don't ignore it. This seemingly minor behavior could be the hidden link. And as we move into the next mistake, you'll see how even breathing, the one thing you do every moment, could either support or sabotage your most personal vitality. Mistake number 3. Rushing the experience. Have you ever asked yourself, when did pleasure become something to get over with, instead of something to be present for? If mistake number 2 surprised you, this one is even more common and more quietly damaging. Most older men don't even realize they're doing it. But it's one of the primary reasons why intimacy starts to feel hollow, disconnected, or emotionally dull. I'm talking about rushing the experience, turning something once sacred into just another task on the list. Over decades of practice, I've seen this habit take root in men, especially those who've lived under pressure, kept things private, or simply learned to get it done quickly. For them, Self-pleasure becomes mechanical. It's about finishing, not feeling. But after age 60, the body doesn't reward speed, it requires presence. I've heard many men say things like, "Doctor, I just want to get it over with, I don't have time to linger." But here's what they're missing. When you rush, your nervous system interprets the experience as stress, not intimacy. Your heart rate spikes, blood vessels constrict, and the neurochemical cocktail your body is supposed to release, oxytocin, dopamine, serotonin, gets cut short. Physically, you might climax, but hormonally and emotionally, your system remains empty. That's why you may feel drained, not recharged, dull, not alive. Worse still, this rush becomes a habit, and your body learns from repetition. Over time, you may start losing sensitivity. You might struggle to stay engaged with a partner. You confuse disconnection for aging when, in reality, it's a learned shortcut that's robbing your deeper experience. But it's not irreversible. The body, especially after 60, is deeply responsive to mindfulness. Slow down, take your time, breathe deeply. Let the act become something intentional, not urgent. Instead of performance, allow presence. There's no finish line here, just the invitation to feel. You don't need to chase a perfect moment. You need to create space for it. Your body still knows how to feel. It's your attention that needs to return. And as we transition to the next mistake, we'll uncover something even more fundamental: how the way you breathe during the act may be silently dictating your strength, your recovery, and your ability to stay connected, both physically and emotionally. Mistake number 4. Ignoring the pelvic floor. Have you ever wondered, what if the root of your struggles with performance or control isn't in your hormones, but in a group of muscles you've likely never even trained? After we've talked about slowing down and becoming more present, it's time to focus on a critical area that most older men neglect, not out of laziness, but simply because no one ever told them it mattered. I'm talking about the pelvic floor. Mistake number 4 is ignoring this essential group of muscles. Most men have never heard the term. Yet the pelvic floor is the literal foundation beneath your bladder, prostate, and sexual organs. It's the silent engine behind erection strength, orgasm control, urinary flow, and even your post-pleasure recovery. But as men, especially if they spend years sitting, tensing the lower abdomen, or bypassing this part of the body entirely, this powerful system weakens, slowly, quietly, until one day, things stop working the way they used to. I once met a man in his late 60s, a former athlete, healthy eater, regular exerciser, who came to me confused. "Doctor," he said, "I'm doing everything right, but something's still off down there." What he didn't know was that his pelvic floor, once strong and active, had gone dormant. Years of disuse and pressure had disconnected him from it. When you engage in self-pleasure without activating those muscles, or worse, when you strain and push, you're placing pressure on the prostate while weakening the very muscles designed to support it. Over time, this can lead to leakage, dribbling, softer erections, and muted sensations. It doesn't happen all at once. It builds year after year, unnoticed. But here's the good news. You can wake those muscles up again, simply by gently contracting. The area you'd use to stop a urine stream, especially during stimulation, you begin to retrain your body to support itself. This builds strength, sensation, and confidence. And as we continue, you'll see how even your breath, something you've been doing since birth, can either reinforce that support or quietly strip it away. Mistake number 5. Too much or too little frequency? What if the problem isn't what you're doing, but how often you're doing it? When we talk about restoring confidence and connection in later life, frequency becomes a quiet but powerful force. Many older men either do too much or too little, and both can slowly throw the entire system out of balance. Most aren't even sure where they fall. Some fear they're doing it too often. Others quietly wonder if they've let it go too long. And somewhere between outdated advice, silent shame, and personal confusion, they end up walking this uncertain path alone. In my decades of practice, I've seen both ends of the spectrum, and both can cause harm. On one side, there are men who engage in self-stimulation too frequently, not from desire, but from habit, boredom, or unprocessed emotion. Over time, the body begins to fall behind. Energy dips, the prostate becomes overstimulated, and the recovery time between sessions increases. They may start noticing a decrease in interest toward real intimacy, a dulling of sensation, and a growing sense of disconnect. It's no longer about pleasure, becomes a routine, and that routine can numb the nervous system and drain vitality. On the other end, some men stop altogether. It may be due to medication, health issues, religious guilt, or the belief that they're too old. But what they don't realize is this: the body, like any system, needs regular circulation. Sexual stimulation, even without orgasm, promotes blood flow to the genitals, nourishes nerve endings, and supports erectile strength. When it disappears for long stretches, muscle atrophy sets in, desire fades, the door to emotional and physical connection begins to close quietly, without warning. So what's the solution? There's no magic number. But for most men, over 61 to 2 times per week, done with intention, presence, and care seems to strike a healthy rhythm. It maintains circulation. It supports hormone patterns. And most importantly, it keeps the system alive without depleting it. This isn't about rules. It's about awareness. Your body doesn't shout as you age. It whispers. And those whispers, fatigue, reduced interest, delayed recovery, are worth listening to. They're not failures. They're signals. Tuning in to your own rhythm is the most powerful shift you can make. Pleasure isn't just about frequency, it's about balance. And in the next section, we'll explore how ignoring that emotional balance during the act might silently unravel everything you've worked to protect. Mistake number 6. Using too much pressure or force. What if the very effort to feel more is actually causing you to feel less? Even when your frequency is balanced and your habits seem healthy, there's one common mistake that can silently undo all your progress. I see it often, and most men don't even realize they're doing it. Applying too much pressure during self-stimulation. This is one of the most overlooked and most damaging habits I observe in older men. I've lost count of how many patients in their 60s and 70s have sat across from me saying things like, "Doctor, it just doesn't feel like it used to," or "It takes more effort every time." And behind those words, hidden quietly, is usually a pattern they've never questioned: gripping too tightly, pushing too hard, or relying on high-pressure surfaces or objects to recreate lost sensation. It's a natural reaction when sensitivity fades. You try to compensate. You squeeze harder. You press more firmly. You chase the intensity you once had. But here's what your body is trying to tell you. Pressure doesn't restore. Sensitivity, it erodes it. The nerves in the penis are incredibly delicate, especially after age 60. Repeated friction, aggressive grip, or excessive compression over The years can lead to real physical consequences: microscopic tissue tears, loss of elasticity, even subdermal scarring. These can cause curvature, reduce blood flow, dull sensation, or even lead to pain during arousal. These injuries don't announce themselves with fireworks. They creep in silently until one day you notice things are different. And often, by then, the damage has already been done. But there's also a deeper emotional layer. When a man feels he has to fight for pleasure, he disconnects from the joy of the experience. The act becomes a struggle instead of healing, and that mental pattern alone can reshape your body's ability to relax and receive. So what's the solution? Start with awareness. Use less force. Choose gentler contact. Stay mindful of your grip, your breath, your presence. Pleasure isn't a performance, it's a conversation with your nervous system. Treat it with care. Your body is not your enemy. It's aging, yes, but it's also still capable of profound feeling if given a chance. So be kinder, be slower. Your future self will thank you. And coming up next, we'll explore the finer land, perhaps most emotionally charged mistake that quietly robs older men of vitality, suppressing emotional intimacy. Mistake number 7, masturbating without emotion, connection, or intention. Have you ever stopped to ask not what you're doing, but why you're doing it? This final mistake reaches deeper than technique, deeper than habit. It lives in the quiet, emotional space that often goes unnoticed, but does the most damage over time. I'm talking about engaging in self-pleasure without any emotional presence, connection, or intention. It's one of the most invisible, yet most heartbreaking mistakes I see in older men. It's not about how often, or even where it's about. How you feel while you're doing it. Over the years, many men begin to treat self-pleasure as mechanical, routine, or emotionally flat. It becomes an automatic escape from loneliness or a mindless ritual performed without feeling, without thought, and without purpose. I've spoken to countless men in their 60s, 70s, and beyond who have quietly admitted, it just doesn't feel the same anymore, or I don't even know why I bother. And it's not that their bodies are broken, it's that their hearts have stepped away. That emotional disconnection causes real harm, not just to the spirit, but to the nervous system and hormonal balance as well. When you separate stimulation from meaning, your body still goes through the motions, but your brain doesn't release the same healing chemicals. Oxytocin, dopamine, and serotonin, the hormones that bring joy, motivation, and calm, don't flow the same way. You may climax, but what remains is a muted echo, a shadow of what once felt full. Worse still, it wires your body to believe pleasure is something done in silence, alone, and without joy. That narrative is damaging, but it doesn't have to end there. Even self-touch can be sacred. It can be intentional. It can be an act of gratitude for a body that has carried you through decades, not something to be rushed or hidden. You still deserve warmth. You still deserve presence. You still deserve to feel. So the next time you find yourself in that moment, pause, breathe, bring your mind back to your body. Don't just chase the experience. Let it be gentle. Let it be real, because when pleasure reconnects with purpose, healing follows. And no matter your age, that's where true vitality begins. What comes next now that we've uncovered all 7 mistakes? Let's bring everything together, because real transformation begins not just with awareness, but with learning how to rebuild, how to reconnect with your strength, confidence, and vitality at any age. So let me ask you this. What if the biggest danger isn't what you've done but what you've stopped noticing? Your body is still speaking to you. And if you've made it this far, I want to talk to you not just as a doctor, but as someone who deeply respects the journey you're on. Over the years, I've witnessed so many good men struggle in silence. They blame age, they blame time. Some even blame themselves. But the truth is, no one ever taught us how to care for our bodies as they age, especially when it comes to sexuality, pleasure, and connection. You've just heard the 7 most common mistakes older men make with self-pleasure. And let me be clear, none of these mistakes come from laziness or ignorance. They come from habit, from decades of doing what once worked, without realizing that the body, like life, changes. Blood flow slows. The prostate becomes more sensitive. The nervous system no longer tolerates pressure or neglect, and the heart aches not just for sensation, but for meaning. Let me say this clearly. There is no shame in touching yourself. There is no shame in seeking comfort, release, or even joy through your own body. The danger arises when we stop paying attention, when we rush, disconnect, or assume that what once worked will always work. Because every one of those mistakes, overusing pornography, poor posture, rushing, ignoring the pelvic floor, imbalance, infrequency, excessive pressure, or emotional disconnection, shares one silent root: disconnection. And that's the real threat. Not aging, not desire, but the slow erosion of your connection to your own body, your own pleasure, your own aliveness. The good news: you can reclaim it, gently, deliberately, with presence, with care. Because the journey isn't about getting back to how things were. It's about waking up to what's still possible now. Your body is still yours. It still feels. It still matters. And starting today, you can begin listening again. So here's the good news. It's not too late. Your body is still speaking to you, even if more softly now. Even if it takes longer to respond, even if it doesn't feel quite like it used to, it's still alive, and it still wants your attention, your patience, your respect, like a vintage engine. It needs to be handled differently, with age, not with fear, but with reverence. In fact, in many ways, this stage of life makes your body more sacred, not less. So where do you go from here? Start small, gentler, more aware. Rediscover your body with intention, not habit. Bring curiosity instead of shame. Stop chasing performance and begin honoring sensation. Breathe, pause, feel, and above all, don't stop believing that connection is still possible within yourself and with others. I've seen men in their 60s, 70s, even 80s transform their health, intimacy, and energy the moment they stopped viewing aging as decline and started seeing it as a transition. You deserve that shift. You deserve to feel again. You deserve to live with awareness, strength, and dignity, even in the most private corners of your life. Because in the end, this isn't just about avoiding mistakes. It's about reclaiming the quiet power still inside you. And I promise you, it's still there. If this message resonated with you, take a moment to share your thoughts or experience in the comments below. You never know who it might help. And if you haven't yet, I gently invite you to like this video, subscribe, and tap the bell for more guidance like this, crafted just for men like you. This next chapter, it's still yours to write.